So this is the very first video blog of 2014, and I'm hoping to be able to do a few of these on a regular basis so that we can stay in touch. So what have I been involved with in the last couple of weeks? Well, towards the end of January, I had the opportunity to meet with representatives of CPCSSN, the Canadian Primary Care Sentinel Surveillance Network. This is a multi-disease electronic record surveillance system, a database on specific chronic diseases that is populated by family doctors who work in groups and use the electronic medical record. It is a very important project for the college. It is currently funded by the Public Health Agency of Canada until the end of March 2015. And I met with those representatives to examine options beyond that time frame. I'm not able to promise anything, but I certainly hope that the college can continue to participate in this project, as it is a very important initiative around capacity building in family medicine research. The other thing I had a chance to do in the last month was to meet the members of the board of the Ontario College of Family Physicians. And I do want to commend their board, as well as specifically the president of the college, Jonathan Kerr, and the CEO, Miss Jessica Hill, because they're doing some fantastic work. During that meeting, I had a chance to share with them what I consider to be the 5 essential elements of what Canadians should expect of their family doctor in 2014. And those 5 elements are that a family doctor is a qualified professional who is able to see all men and women of any age for all presenting problems, to provide superb follow-up, and both words are important, superb and follow-up, to look after a defined population of patients, and by that I mean that each patient that we see is important, but it's also important for us to know who is the population of patients that the practice is looking after, and just making sure we're doing a good job of looking after them. And the last point, which is to be working in more than one practice setting. And by that I mean not that I expect family physicians to be everywhere like I was 30 years ago, in the office, in the hospital, in the case room, in the emergency department, and do house calls. But I do expect family physicians in 2014 to not only be in their office, and really to be a resource to populations in other practice settings. So it was interesting because I shared that with them, and in fact the members of the OCFP board were very receptive to those ideas. They provided me with some feedback, and I encourage you to also provide me with some feedback, and that will be welcome, and it will give me a chance to sort of tweak my message as I move forward. We're looking forward, Dr. Kathy Lawrence, our president, and myself, to go to the Alberta College of Family Physicians board meeting and annual scientific assembly. So this is going to happen later on this month. Kathy had the opportunity recently to attend a meeting about prescription drug misuse and abuse. This meeting was sponsored by the Government of Canada and by the Canadian Centre for Substance Abuse. And during that meeting, Kathy had an opportunity to share with participants some of the work that the college is doing in the area of addiction medicine, mental health, chronic pain, and she also was able to talk about the pillars of the patient medical home. You're seeing behind me the 60-20 logo, and this is there because this year is the 60th anniversary of the college and the 20th anniversary of the foundation. We have a number of events that are planned around this celebration, articles that will be published in our journal, Canadian Family Physician, and of course, special events during Family Medicine Forum, which will be in Quebec City, November 13th to 15th. So I hope that you can join us in that celebration. And so that's it for now, and I wish you a good week. Stay warm and try to enjoy a little bit of what winter has to offer.